you to approach the person, do so. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If the person is unresponsive, have a bystander activate EMS and get an AED. Look at the face and chest for normal breathing. This person is breathing normally. Placing her in the recovery position will protect her airway. Begin by placing the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg just above the knee and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the patient towards you in a single motion, keeping the head, shoulders, and torso from twisting. Make sure the head ends up resting on the extended arm and the head, neck, and torso are in line. Roll far enough for the face to be angled forward. Position the elbow and knee to help stabilize the head and body. Make sure there is no pressure on the chest that might restrict breathing.
Lynn!
If an unresponsive person has been seriously injured, do not move him, unless you are alone and need to leave to get help. Frequently assess the breathing of anyone placed in a recovery position. The condition can quickly become worse and require additional care.
Yes, he is breathing. Someone's with him.
So I think we need to push the schedule back another week. That way we have enough time to find a new supplier.
Okay, sounds good. So that would be the 4th. April? April! April, it's Sarah. Can you hear me?
Front desk.
This is Sarah. I'm in the conference room. April's collapsed. I need you to call for EMS and get me the AED.
Okay. Hi, this is Jackson Publishing. Yes, one of our employees has just collapsed.
When a person is unresponsive and does not appear to be breathing or is only gasping, she is considered to be in cardiac arrest and requires CPR. Once started, do the best you can. A person without breathing or circulation cannot survive. Nothing you do can make the outcome worse.
Okay, I'll pick you up on that room's extension. Hold on. Here's the AD.
Adult patient.
Hi, it's me.
If it is safe for you to approach, do so. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If unresponsive, have a bystander activate EMS and, if one is available, get an AED. Quickly observe the face and chest for normal breathing. If the person is not breathing or only gasping, begin CPR. Locate the proper hand position and start compressing the chest at a rate of at least 100 times per minute. After 30 compressions, tilt the head, lift the chin, and provide 2 rescue breaths. Quickly return to chest compressions. Without interruption, perform continuous cycles of 30 compressions and 2 rescue breaths. Remember to compress hard and fast and allow the chest to fully rebound to its normal position after each compression. Giving effective chest compressions can be tiring. When others can help, take turns performing compressions. Switch compressors about every 2 minutes. Change quickly to minimize interruption. Continue CPR until an AED is ready, another provider or EMS personnel take over, or you are too exhausted to continue. If an AED becomes available, turn it on immediately and follow the AED's voice instructions for using it.
Remove clothes from patient's chest.
If you are unable or unwilling to give rescue breaths, perform compression-only CPR. Without interruption, provide ongoing compressions at a rate of at least 100 times per minute until an AED is ready, another provider or EMS personnel take over, or you are too exhausted to continue. If others are available, switch compressors about every 2 minutes.
AEDs are designed to be simple to operate. Voice, lights, and screen instructions guide an operator in using the device. There are many different brands of AEDs, but the same basic steps for operation apply to all of them. Turn on the AED. This starts voice instructions and readies the device for use. Opening the lid will turn on the power with some AEDs. With others, a power button is pressed. Adhere the defibrillation pads to the person's bare chest. Pads are placed in specific locations to direct the electrical shock through the heart. Most pads are pre-connected to the device, but some AEDs require you to plug in a connector. Allow the AED to analyze the heart rhythm. An AED automatically starts analyzing once the pads are in place. If defibrillation is required, the AED will charge to get ready for shock delivery. Safely deliver a shock if directed to by the AED. Keeping others clear, a button is pressed on most AEDs to deliver a shock. Immediately after a shock is delivered, CPR is resumed, starting with chest compressions. Voice instructions and additional analysis by the AED will guide providers through further care.
Stan, what's wrong? Somebody help me, I need help.
I'm trained to help. I'm a team, okay?
Thank you.
Sir, are you okay? Are you okay, sir?
Here, put these on. Here's a mask.
Thank you. He's not responding.
Dom, this is Sarah. We have a guest who's just
collapsed in the foyer by the fireplace. He's not responding. Can you activate the emergency plan?
Understood. Okay. Grab the AED and the emergency bag. I'll call EMS. Yes, this is the Albion Hotel on 34th Street. We've had a guest collapse in our lobby. All I know is that he's unresponsive.
Remove clothes from patient's chest.
I got it.
When patient's chest is bare, look carefully at the pictures on the white adhesive pad. Peel one white pad from the gray case. Place pad exactly as shown. Peel white pads from gray plastic case. Press pads firmly to patient's bare skin. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now.
Here we go.
Shock delivered.
Start CPR again. Let's get him on his side.
Okay.
I've got his head.
Okay.
Effective CPR, along with rapid defibrillation using an AED, provides the most effective early treatment option for sudden cardiac arrest. If it is safe for you to approach, do so. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If unresponsive, have a bystander activate EMS and get an AED. Quickly look at the face and chest for normal breathing. If the person is not breathing or only gasping, begin CPR. Without interruption, perform continuous cycles of 30 compressions and 2 rescue breaths. Perform CPR until an AED is ready to analyze the heart rhythm. Position the AED close to the head. Open the case and turn on the power.
Remove clothes from patient's chest.
Defibrillation pads must be applied to a bare chest. If needed, quickly tear or use scissors to remove clothing, including undergarments. Remove the defibrillation pads from their packaging. The pads have pictures on them to assist in proper placement. Carefully look at the pictures to ensure the pads are accurately placed. Peel the pads from the backing sheet one at a time and place them exactly as indicated in the pictures. Place one pad below the right collarbone, above the nipple, and beside the breastbone. Make sure it adheres well by pressing it flat. Place the other pad lower on the left side over the ribs and a few inches below the armpit. Again, press firmly. AEDs automatically start analyzing once the pads are in place.
Analyzing heart rhythm.
Movement can interrupt the analysis. Be certain that no one is touching the person. If defibrillation is required, an AED will charge to deliver a shock.
Shock advised. Stay clear of patient.
Give a verbal warning and look to make sure no one, including you, is in contact with the person before delivering the shock. Immediately after delivering the shock, resume CPR, starting with chest compressions. If the person responds, stop CPR and place him in a recovery position. Leave the AED on and attached in case cardiac arrest returns. When a shock is not indicated by the AED,
no shock advised.
Simply resume CPR, starting with chest compressions, and continue to follow any voice instructions. Don't stop until the person shows signs of life, another provider or EMS personnel take over, or you are too exhausted to continue. AEDs are designed to detect problems during use and guide you through corrective actions. If a troubleshooting message occurs, stay calm and follow the AED's voice instructions. If the AED indicates a problem with the pads are not completely adhered to the skin, or there is a poor connection to the AED. Press pads firmly, especially in the center, to make sure they are adhering well. Make sure the pad's cable connector is firmly connected to the AED. If the chest is wet, remove pads and wipe the chest dry. Apply a new set of pads. If pads do not stick due to chest hair, pull the pads off and quickly shave the hair. Attach another set of pads. Another troubleshooting message may indicate that analysis has been interrupted due to movement. Stop all sources of movement, such as chest compressions or rescue breaths. If a message indicates the need to replace a battery, there may only be enough energy for a limited number of shocks. If the AED fails to operate, the depleted battery should be removed and replaced with a new one. A person should be removed from standing water before using an AED. It is okay to use an AED when a person is lying on a wet surface, such as in the rain or near a swimming pool. An AED should never be immersed in water or have fluids spilled on it. AEDs can also be used safely on metal surfaces, such as gratings or stairwells. Make sure pads do not directly touch any metal surface. Someone may have a surgically implanted device in the chest, such as a pacemaker or an automated internal defibrillator. A noticeable lump and surgical scar will be visible. If the implanted device is in the way of correct pad placement, place the pads so the edges are at least 1 inch away from the device. Defibrillating over medication patches could reduce the effectiveness of the shock. If a medication patch is interfering with placement, use a gloved hand to peel off the patch and wipe away any remaining residue before placing pads.
Choking can occur when a solid object, such as a piece of food or small object, enters a narrowed part of the airway and becomes stuck. On inhalation, the object can be drawn tighter into the airway and block air from entering the lungs. A forceful thrust beneath the ribs and up into the diaphragm can compress the air in the chest and pop the object out of the airway. Direct compression of the chest over the breastbone can also create enough pressure to expel an object. You must be able to recognize the difference between a mild blockage and a severe blockage. With a mild blockage, a person can speak, cough, or gag. This type of blockage is typically cleared by coughing. Encourage someone with a mild blockage to cough forcibly. Stay close and be ready to take action if things worsen. When a severe blockage occurs, a person cannot dislodge the object on his own. Signs of severe obstruction include very little or no air exchange, lack of sound, and the inability to speak or cough forcefully. The person may hold his hands to his throat as he attempts to clear an obstruction naturally. Your help is required to save the person's life. To care for someone who you suspect is choking, begin by asking, "Are you choking?" If the person nods yes or is unable to speak, cough, or cry, act quickly. Stand behind the person, reach around and locate the person's navel with your finger. Make a fist and place the thumb side against the abdomen, just above your finger and below the ribs. Grasp your fist with your other hand. Give a quick inward and upward thrust. Repeat thrusts. Each thrust needs to be given with the intent of expelling the object. Repeat thrusts until the person can breathe normally. If the person becomes unresponsive, carefully lower her to the ground. If not already done, activate EMS. Begin CPR, starting with compressions. Look in the mouth for an object after each set of compressions before giving rescue breaths. Remove any object if seen. Continue until the person shows obvious signs of life or another provider or EMS personnel take over. When someone is clearly pregnant or obese, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist on the center of the chest. Grasp your fist with the other hand and thrust straight backward. Try to not put pressure on the ribs. If you are alone, try pressing your abdomen quickly against a rigid surface, such as the back of a chair. If one is not available, attempt abdominal thrusts on yourself. Abdominal and chest thrusts can cause internal injury. Anyone who has been treated for choking with these maneuvers should be evaluated by EMS or a physician to ensure there were no injuries.
Just as with an unresponsive person, the primary assessment for someone who is responsive is to assess for and immediately treat life-threatening problems, including bleeding and shock. If it is safe for you to approach, do so. Introduce yourself. Let the person know you are first aid trained and there to help. Check for a diminished level of responsiveness. Assess for any difficulty in breathing. Scan the body for serious bleeding. If found, control it immediately. Check the face for tissue color. Assess the palms of the hands, fingernails, or inside of the lip of a dark-skinned person. Tissue color depends on the amount of blood circulating below the skin. Normal tissue color is light pink. Paleness can indicate blood loss or shock. A bluish color can indicate a lack of oxygen. Assess skin temperature by touching the forehead with your bare wrist. Normal skin feels warm and dry. Cool, wet skin can be an indication of shock. Quickly activate EMS and provide any primary care when a life-threatening medical condition is found or suspected. When a primary assessment indicates no life-threatening problems, complete a secondary assessment to gather additional information. Quickly try to determine the person's chief complaint. Ask him what happened. If he cannot answer, ask bystanders. The person may have a medical alert bracelet or necklace identifying a medical condition that could be related to the current problem. The mechanism or forces that caused an injury may help predict the presence of a hidden injury. Clues in the environment, such as the temperature or the presence of medications or containers, may help identify the cause of the chief complaint. Physically assess the person. Briefly assess the body from head to toe. Look and feel for signs of illness and injury. The DOTS acronym helps to remind you what to look for: deformities, open injuries, tenderness, swelling. If needed, remove or cut away clothing to get a better look at an affected body part. If at any time you suspect spinal injury, immediately provide spinal motion restriction by manually stabilizing the head. Ask questions. Use the acronym SAMPLE, S-A-M-P-L-E, to help you remember what to ask about. Things the person is feeling, such as pain, nausea, dizziness, or anything related to the situation. Things the person may be allergic to. Medications the person has been prescribed or is taking. Medical problems that may be related to what is going on. When the person last ate or drank. What the person was doing just prior to the problem. If you find or begin to suspect a life-threatening problem is occurring while performing a secondary assessment, stop, quickly activate EMS, and provide the primary care.
When's the next shipment getting in?
Anytime. That's why we need to get this done as quick as we can. Ah, nuts! I cut myself.
Blood vessels are present throughout the body. Bleeding occurs when tissues are damaged. Heavy bleeding is likely if a major blood vessel is damaged.
Kenny!
I need the first aid kit.
Bleeding reduces the oxygen carrying capacity of blood. If heavy or uncontrolled, bleeding can quickly become life-threatening. Arterial bleeding is bright red and will often spurt from a wound. It can be difficult to control due to the pressure created by the heart's contractions. If the blood is dark red and flowing steadily, it is likely coming from a damaged vein. Bleeding from a vein can be heavy. Regardless of the source, all heavy bleeding must be controlled as soon as possible. Clot-forming fibers naturally collect at a wound site to create a patch to stop bleeding. Severe bleeding can overwhelm this process and prevent clotting from occurring. Activate EMS immediately for any heavy bleeding.
Go call EMS.
Okay.
Bleeding exposes you, the provider, to potentially infectious body fluids. Always use protective barriers, such as disposable gloves, to protect both you and the injured person.
Okay, I'm gonna have you move your hand, and then I'm gonna put the pressure on with this, okay?
Okay.
Continuous firm and direct pressure applied to a wound is the best method for controlling external bleeding. Quickly expose and inspect the wound. Using a clean, absorbent pad or dressing, apply direct pressure with the flat parts of your fingers directly on the point of bleeding. If a pad is not available, apply direct pressure with just your gloved hand. If blood soaks through the pad, apply another pad, leaving the initial pad in place. Apply more pressure with the palm of your hand. Apply a pressure bandage to provide continuous pressure to the wound. Wrap a roller gauze or elastic bandage around the injury with enough pressure to maintain bleeding control. Avoid wrapping the bandage so tightly that the skin beyond the bandage becomes cool to the touch, bluish, or numb. Make sure a finger can be slipped under the bandage once it is applied. When barriers are not available, an injured person can provide self-care, or a provider can use improvised barriers, such as a plastic bag.